Assalamu alaikum. I am Dr. Naghmana Shafi, and I'm going to talk about helping babies survive and kangaroo mother care today. Helping babies survive and kangaroo mother care is a very, very important program. And before I start, I would like to acknowledge my resources. It is from American Academy of Pediatrics, WHO, and UNICEF. So it's so important to talk about babies who we can save with these programs, because globally 2.3 million babies die in first 20 days of life. Premature birth complication, asphyxia, trauma, and neonatal infections are the leading causes of neonatal deaths. About 1 million newborns die within first 24 hours of life, which helping babies survive can save. Most neonatal deaths, about 75% of those occur during first week of life. Pakistan has a neonatal mortality rate of 39 of 1,000. It is a 2022 number, but it is though it is one of the highest rates in the world, but it is down from 48 in 2012. So yes, we have made a progress. Helping babies survive and kangaroo mother care programs address this challenge. It reduced the neonatal mortality by 50% world over. So what I am going to do in this particular session is that give you an introduction of the program, and I would connect you to some teams so you can conduct these programs in your institutions. It's very important to train everyone for these programs. These are hands-on training programs which were reduced by American Academy of Pediatrics and WHO to reduce the neonatal mortality. Helping Babies Survive, which was started by American Academy of Pediatrics, it had Helping Babies Breathe component first, which was in 2010, and then they added Essential Care for Every Baby, which is for the normal newborns, Essential Care for Small Babies, and Improving Care of Mothers and Babies. I will be focusing on Helping Babies Breathe and Essential Care for Small Babies, which is basically all the kangaroo mother care. So these resources are available to you. This is a very important slide to take a picture of. It connects you to all the resources for helping babies survive. They are available from American Academy of Pediatrics global website, and they're available in Urdu, Sindhi, and Pashto in addition to English. They're free to download, and it also has some WHO resources and some UNICEF resources for what I'm going to present today. So helping babies survive, this is the first component of saving a newborn's life. It is all about the golden minute, which is the first minute of the newborn's life. This is the key concept. So what I am going to do with this particular program, as I am giving an overview to all the professionals here who are going to train others, I'm going to give you the overview, and I just want to let you know that when we train nursing staff, midwives, and people who have less proficiency for English, we like to show them pictures. So I'm going to show you the pictures, but I'm just going to change the slides faster to give you an idea that that's what we will be presenting when we do these training sessions for you. So in golden minute, the concept is that either baby breathes by herself or himself, or someone is breathing for baby by a bag and mask. So in order to do this in your institution, you have to get a training done. You have to get all these resources. And then you also have to contact, if you can, the midwives and lady health visitors in your area and provide them with equipment which should be carried during each home birth. Download all these materials and keep doing these trainings regularly in your institution, maybe like once a month, because if you would not practice, then you will forget. So the background is that most babies who do not breathe at birth have a heartbeat. So the whole focus, which used to be in the past on doing the chest compression, giving the medication, and all that has been completely changed. Focus is on breathe, breathe, breathe. Because babies who do not breathe at birth, most of them have a heartbeat, and they will respond to just cleaning the airway and stimulation of the breathing. Or you can just ventilate them with a bag and mask. 1 in 10 babies born will need some help to breathe. So preparation of birth, when you have a skilled birth attendant at home, we kind of train them how to clean the area, get it ready. If you are in a hospital, then just make sure that all the equipment is there and is functioning. And each delivery should have a bulb suction for the baby, a bag and mask, and make sure it's working. So this is the picture, which was, as I said, that once we train, we show it to nursing staff, and it's a very good visual reminder of how to do every step. Now you have to be, as I said, very, very quick, just like quickly you have to do all those things, because you have to do all those things within 1 minute. That's a great change from the time when people used to wait for Apgar's long. 1 minute, golden minute. You have to do everything to save baby's life. So you do rapidly assess the baby and then go to the next step. The first step is drying. So you dry the baby, and if meconium is present, then clear the airway before drying. And there are 3 questions we have to keep repeating during this whole resuscitation. Is baby crying? Is baby breathing? And does baby have a heart rate? It means that baby is crying, baby is breathing, heart rate is okay. So babies who are crying and pink, they're fine. So you have to keep them warm, and you just have to check their breathing and cut the cord after the delivery. Routine care, just keep them warm, keep them skin to skin with mom, cover their head and body, and then keep checking their breathing. And then you can clamp cord after 1 to 3 minutes of birth, and then keep mom and baby together skin to skin for 1 hour. If baby is not crying, they are the ones who are not breathing, or they are breathing, but they're not breathing good enough, and their skin may be pale, bluish or limp, or they may be gasping or grunting with nasal flaring and intercostal retractions of chest wall. So these are the babies you have to help. So you clear their airway, you dry them, and then you keep them warm, and then you suction with the bulb suction, and this stimulates the baby to cry. And you just have to rub their back gently. You don't have to turn them upside down or slap their back and things like that. Just rubbing gently does the trick. So you check the baby again. Is baby breathing well? You are good. If baby is not crying at all, these babies are not breathing. They are gasping, they're grunting, they have a noisy breathing, shallow breathing. You quickly tie and cut the cord. You don't waste a single second. And then you move the baby to this area where you are going to resuscitate this baby. If you are going to delay it, you can cause brain damage or death. So you stand by the baby's head, you select a bag and mask, and then you start giving baby ventilation with a bag and mask. And then you have to keep positioning it to make sure that it is positioned correctly. And then you have to squeeze it and move the bag gently. And you have to do it in a way the chest rises up and down and baby is breathing comfortably. You have to give 4 breaths per minute. And usually if you count loud, breathe 2, 3, squeeze on the breath and release as you say 2 and 3. So breathe 2, 3. During ventilation, see baby is breathing well. If baby's color is changing, baby has started to breathe, the heart rate is going up, the baby has started to move, tone is good, baby's breathing. Soon baby will start breathing all by herself. If baby is not breathing, then quickly call for help. You have to call for pediatrics. If it's a home delivery, the lady health visitor or midwife has to call someone else for the baby. And then you try to see what else you can do. You clean the mouth again, you reposition the bag, and you keep squeezing it and helping the baby. So that's something which is very, very important, that you help baby breathe within the golden minute. Now you're going to monitor mom and baby for 1 hour to make sure that baby is okay. If baby is not breathing after ventilation, during this 1 minute, then you need to check the heart rate. Is it normal or is it slow? And then it's a very quick trick. You get the baby's cord and you feel it. And I usually teach people during the training to feel their own pulse. Just get like a rhythm of the pulse. Just you are feeling it. So if baby's pulse is faster than the pulse which you are feeling in your hand, then heart is fine. You don't even have to worry about counting it. If the feeling of the pulse is less than yours, then you know that you need to help the baby. With these few tricks, you can do things much, much faster. So if it's more than 100 per minute, it's normal. And if it's less, then it's slow. So these are the babies where you have to start doing the bed and mask ventilation again. So you keep doing it, and heart will come up. And then if his baby's heart rate is good, you can stop ventilation and will monitor the baby. So you keep ventilating until baby is breathing well, and then you keep the baby with mom and monitor the baby. If baby is not breathing and heart rate is slow or normal, then you continue the ventilation and seek the advanced care and call the pediatrics and keep checking the heart rate at 5 minutes and then 10 minutes. No breathing, heart rate is slow or normal, especially baby is not breathing after 10 minutes, then you basically can just stop resuscitation, and a baby who never breathes do not need any kind of resuscitation. Cleaning the equipment is very easy. This comes with all the pictures. You can clean the equipment, get the equipment, and you can keep it in your labor rooms. And midwives and lady health visitors should carry this. And this is a very nice poster. You can print it from the website, which I gave you, and then keep it in the labor room. So even people forget whatever they trained, they can look at the picture quickly and remember. Now, Shine Humanity is an organization for, I'm working for them, and we are doing these trainings since 2013. So it's almost 11 years now. I have taught many workshops in Pakistan, and we do provide these equipments, as you are seeing, to each institution. So you can continue training, and we have given supplies to midwives as well. So you can contact us and we can arrange these trainings for you. Moving on to Kangaroo Mother Care. This is a care which can save lots and lots of lives. Mom and baby were together. I always tell this. Mom and baby used to be together for centuries when women gave birth at home. Modern medicine saved the lives of moms and babies, but it also made everything very hospital-like. So once all this was realized, the medical community changed it. And now we know that mom and baby have to stay together after they are born. And then they went one step further, and all the babies who were premature and well, they were also kept with their moms, and actually they needed less resources and they gained weight better. Their vital signs were more stable. So Kangaroo Mother Care is a way to go. Actually, some physicians say that the new concept of neonatal ICUs are that there is a bed and mom is sitting next to a baby, or you can have mom's bed next to her in a room. So it is very, very important that we go for this. It can save lots and lots of babies, and it will decrease all the cost of caring for the preterm babies. Now, Kangaroo Mother Care can be provided both for preterm as well as full-term babies. I usually tell people too that think about it, all these women who used to work in fields, and they used to tie their baby in dupatta and sari on their back so their hands are free. You're doing exactly the same thing. We are just keeping the baby in the front instead of keeping in the back. So it is well known that early continuous prolonged skin-to-skin contact between mom and baby and exclusive breastfeeding is initiated in the hospital, and it can be continued at home. Small babies can be discharged early, and moms will need the support after discharge as well. It's a very gentle and effective method. Essential care for small babies is kind of incorporated in the Kangaroo Care and definition of a well small baby. Now, remember, this care which you are going to develop in your maternity homes is for the babies who are well. They are small, but they are well. So definition is weighs between 1,500 and 2,500 grams, breathes well, maintains a normal temperature with thermal care, feeds by breast, cup, or nasogastric tube, gains weight, and does not have a danger sign. So Kangaroo Mother Care for a well baby, it can happen in small maternity homes with several deliveries per day, and it can be provided by midwives, nurses, doctors. Make sure that the place has supply of previous things like oxygen, medicines, warmer formula, and the rooms should be equipped with a comfortable bed and chairs for mom, and the beds and chairs should be adjusted so she can kind of move back and forth with the baby and be more comfortable. Curtains can help to ensure privacy in the room, and the room should be warm and comfortable for babies. Mom will, of course, need a bathroom facilities next to the room, and make sure that mom eats a healthy diet. And there should be another room where mom can have privacy, and the family should be able to visit whenever they want. So this is kind of a setup where you can see there are moms, more than one mom sitting with their newborns, holding them in the kangaroo care way. It is something very simple. Most of the places where we are working, like in United States, we don't have any special binders or anything, which I have been seeing in some things quite a bit. And I had a discussion with some colleagues about it. If you want to use a special binder, that's fine, but you can use dupatta. You can use any wrap to wrap the baby with mom. And you have to put baby in a way that baby's face is turned to the side, hands are free, and legs are like a frog leg position. So when you are planning to do kangaroo care for a mom and baby, make sure you talk to mom before delivery. You need to talk to both mom and dad. You need to talk to aunt, uncle, grandma, lot of family members, because this is something which needs the support for the whole family. If mom has to do it, she has to take care of this baby for multiple days, and someone else to take care of her other kids. If grandma or aunt wants to help or dad wants to help, they need to learn about it too. So you have to explain the whole thing to the family, ideally before baby's birth. And then once the baby is born, start skin to skin care, keep mom and baby together, uncover the areas only which you need for the care, check temperature by feeling the foot or the forehead about every 15 minutes until temperature can be measured. Essential care, you have to monitor 3 components. Breathing, if it is more than 60 and chest isn't drawing, there's a problem. You have to check breathing every 15 minutes until you do a complete exam in 1 hour. Initiate breastfeeding as soon as baby shows hunger cues, open her mouth, looks around, wants to eat, you feed them. And then you don't want to interrupt for any other. If you want to give any injections, if you want to provide cord care, you want to provide care of the eye, you don't move the baby. And then you cover the baby with a blanket to keep baby comfortable. Within 90 minutes of a delivery of a small baby, you have to classify if the baby is a well baby, can stay with you, or baby has to be transferred. So now the unwell baby is the one who is less than 1,500 grams or has a danger sign like fast breathing, chest indrawing, temperature is not maintaining, and you can wait up to 4 hours if baby does all these things intermittently. So let's say that has a respiratory rate of 60, but then settles down. Doesn't want to eat in first 30 minutes, but then starts eating. So if they do it back and forth, you can give 4 hours to the baby to decide if you are going to keep the baby or you have to transfer the baby. Now, first step of the care is maintaining the thermal care, which is with skin to skin for first 24 hours after birth. Dry the baby thoroughly, don't bathe them. That's the big thing. You have to wipe the baby. You cannot wash them with water and all this. You put on a diaper and you cover the head. You place the baby, as we looked in the picture, upright on the chest between the breasts, position the arms and legs, flex and head turn, and then wrap the baby with a dupatta or a wrap. Check temperature by feeling the forehead or the foot, and then take the temperature if baby is cold or hot. And all these things, once you have established it, you keep an eye on it. You put the socks on the baby. If baby is colder, you put another blanket. You put, and if baby's clothes are getting wet, you have to change them. So these are some pictures where mom and babies are there, dad and babies there, and you can see that it can be done in any way with any kind of dresses with mom or dad are wearing, and then you can put any blanket on it. So these pictures, again, they should be on the wall of the labor room, so whoever is helping can see. And you can actually show it to mom if you're expecting a preterm delivery. So essential care is usually continuous for more than 20 hours of the day, and it can be provided by mom, grandma, father, anyone. Mom can do whatever she wants while she's providing this care. She can sleep, she can watch TV, she can do whatever she wants. And you have to make sure that you keep supporting her and you let the family members come in. And you have to give her the confidence. Other than giving her the confidence to do that, you also have to tell her when she needs to call for help. So the important thing is that baby is less active, the same way as you tell them to watch for the kick count when she's pregnant. You tell them that activity is low or baby is having convulsions, if baby is breathing fast, if the color is looking pale blue, if temperature is hot or cold. And if that happens, you try to help out and you reassess the baby in an hour. Let's talk about the second component, which is feeding. Breast milk is best food for small babies. Small babies may not have the skills to do it in the beginning, so they have to learn it better. And tell mom that she can breastfeed in this position, and it actually makes the breastfeeding easier. Holding the baby close to the breast stimulates the milk production. And support the baby. So evaluate how effectively they are feeding and they're not choking when they're eating or turning blue. So a baby who is feeding okay is the one who is breastfeeding at least 10 minutes per side, and is sleeping between the feedings and has 6 to 8 diapers per day. So it usually starts in the beginning by 1 to 2 diapers per day, 2 or 3 diapers on the day number 3 and 4, then eventually 6 to 8 wet diapers per day. This baby all the babies actually should not lose more than 10% of their birth weight within first few days of life. If baby cannot breastfeed, then you help mom to feed the baby by expressing the breast milk and cup feeding or feeding by nasogastric tube. And then again, you feed the baby same way, 2 to 3 hours, 4 hours, you put in the cup, you teach mom how to cup feed. And train your staff members to how to do that. And once we do the training for the Kangaroo Care, and there are so many videos available. Actually, everyone can have a training program with all the videos which are available online. And it's very easy to train in any institution. And I am available to help you out to give you those resources. It's very easy to teach all of them in a few hours and then continue the education. There are a lot of breastfeeding counseling training programs available by WHO and other organizations. So make sure you have one nurse and midwife who is very well trained in helping moms with breastfeeding. So weigh these small babies daily and check weight to assess that everything is going well, they're gaining weight. So as they lose weight, as I said, 10% in first few days is fine, and then they should start regaining their weight. So usually between 7 to 14 days after birth, they gain weight. Once they start gaining it, they should continue to gain. They should not lose them. And there is no upper limit, but they should at least gain 15 grams per kilogram per day. So danger signs, one more time, when you have to transfer these babies, you have to be careful. If weight is low, baby is cold, baby is not breathing, grunting, there's infection of the cord, you have jaundice, feeding intolerance, poor weight gain, convulsions, diarrhea, and you try to stabilize the baby. You can actually stabilize the baby in the Kangaroo Care for the transfer. You can actually give oxygen while mom is still holding the baby. You can put the IV, you can put the nasogastric tube, and then you can transfer the baby in Kangaroo Care position. So this is another poster which kind of summarizes all what I said. A very good one to put in the labor room or in the rooms for the Kangaroo Care, where Kangaroo Care is provided, so people can go through the steps. When mother and baby are comfortable, then you do it as long as possible. And once you can continue it until baby reaches about 40 weeks of life or is 2,500 grams. So initially you will be measuring their temperature every 6 hours, but once they are stable, then you don't have to do it that much. Twice a day is fine. And then if there's a problem, then you cover the baby up and take the temperature again. So babies can receive most of the care, as I said, feeding and all that in Kangaroo Care. They can only be removed for the diaper changes. You don't have to bathe them daily. And if you want to bathe them, just wipe them with a wet cloth. Don't put them in the water and wash them. During the day, mom can do whatever she likes, as we said. and if she wants to keep herself clean, and she has to eat a healthy diet. And most women feel comfortable sleeping in a kangaroo position. I showed you the chair, and they can also get that support in the bed. Record keeping is very important. So each pair, mom and baby, they should get that how much they're eating, what is the baby's weight, and when you get their vital signs, respiratory rate, heart rate, temperature, that's important. Also ask her, nurses should ask her every shift, maybe 8 hours or so, how did baby do? What was, if she has any concerns, questions, and very important to keep the count of the wet diapers and stool diapers. Once baby is feeding well and maintaining temperature, then baby can go home. So discharge planning, that's what we look at it. When baby is about 2,000 grams and can maintain a normal temperature. And then the question is, when will we stop it? Well, when baby does not like it. Babies will start kicking, moving. They don't want to be wrapped. It means they don't want it anymore. And baby is ready for discharge when breathing is normal, temperature is stable, and they're gaining weight, and there's no infection. Weight gain is consistent for 3 days. It's important before the discharge, and both mom and baby are good with breastfeeding or whatever way they are feeding. Postnatal care is arranged for both mom and baby. They have to, someone has to go to their home and see them, or they have to come to get checked twice a week until they are 2,000 grams, and once a week until 2,500 grams. And at home, you have to educate them that they have to keep things clean, hand washing, protect baby from any infections, sick people and stuff like that. And they have to come to the clinic on a regular basis for weighing and immunizations. Or if you have a midwife or lady health visitor who can go there, that's great. They can just go home and weigh the baby. So the family who is providing kangaroo care at home will need support. So they have to have someone like a lady health visitor or midwife there. Frequency of visits, you can decide what each pair needs, but this was like a idea that start from daily, and then you can decrease it to 2 times a week to twice a week, and then so forth. So this was kind of a summary, and this is the way to go. And I'm available for any questions you have.